that expense is very significant, and most organizations don't have it budgeted in their bottom line to absorb that. It's often 6 figures, could be closer to 7 figures, depending on how many records, protected health information your organization has. Okay. So what is protected health information? This slide just gives you the definitive definition of what PHI really means when they refer to it in the laws. So if anything that reasonably could identify somebody or does identify them, and it relates to past, present, or future medical or health condition or provision of care to the individual. So it would definitely encompass dental care as well. Okay. Next, what's a covered entity? What's a business associate under the HITECH Act? Well, here's your definition. Covered entity is going to be any physician office which encompasses dental practices as well. And your business associates are really anybody that touches your patient's protected health information on your behalf. They expose you potentially to that ultimate liability or fines and penalties if they don't handle them correctly. They can be gone after as well by the government, but the government has indicated that they're very busy and they have plenty to do going after the covered entities. So right now their focus from an enforcement perspective isn't on those business associate vendors that are doing your billing or are doing storage of the data, as much as they are looking at the covered entity. Did you do your due diligence and your homework before you turned over to this vendor, service provider, business associate, your patient's PHI? Because if they have a breach with very, very sloppy controls in place, shame on you is the way that it's eventually going to boomerang back on the dental practice. Okay. Notification requirements, there were none, as I said, prior to HITECH. Now, covered entities have to notify affected individuals when there's been a breach. And we talked about, the low probability analysis that can be done by a documented risk assessment. It is a little risky to say to the government after the fact, we didn't notify anybody, and we didn't think we had to because of A, B, and C. The government's going to be assuming you should have notified, but it's an argument, that can be made in certain circumstances, obviously up to your organization's discretion. There is a caveat for notification under the HITECH Act not being required where the disclosure is inconsequential, meaning that it was shared with a dentist in another practice by mistake and it was pulled right back before anything was done with it, something like that. They don't want, the feeling is that too much notification is going to make patients unnecessarily anxious and perhaps, create some fatigue in the consumer